was not passing the buck on Tim, but I did want him to be able to, and I wanted to be able to reiterate the issue about communicating with our offices. As Tim has said, I've heard from many of you. I recognize faces that I've seen at the Delaware State Fair, that I've seen at the Congressman's previous healthcare town halls that we had. But if I could very briefly, I'm going to differ from Tim in that I do have a statement. The Congressman is out of town today, but I do want to thank I want to thank this group of panelists, who many of you were actually at our healthcare forum, or the Congressman's healthcare forum. And again, we appreciate hearing your insight into this issue. Very briefly, though, the Congressman would like to be clear about his position in this debate. And he's, as I said, recently held several public town hall meetings in all 3 counties and 2 town halls where we literally reached out to 60,000 households across the state. Bottom line is, he had to reach out, just so you all are clear, the Congressman had to reach out earlier, much more so than the recent media coverage, because he knew he would have to take a position on the House bill, which was in the Education and Labor Committee several weeks ago. Congressman Castle voted no on that House bill in the committee, and he feels strongly that the bill required a major bipartisan overhaul. His record is supportive of lowering the cost of services and care, lowering the cost of insurance. Many of you know that the cost of care, if you pay cash, is actually can be 30% less than if you use insurance. This is a big red flag for the Congressman that this process is flawed. The Congressman's concerned about protecting Medicare, Medicaid, and Social Security first as a priority. He also wants to ensure that you keep the coverage that you currently have, if you have it. So again, the idea of, we heard that loud and clear, keeping the coverage I have, I want that opportunity. Congressman has lent his support to 2 alternative approaches to achieving meaningful reform. One of them is the Healthy Americans Act. It is the only bipartisan proposal to be introduced in the House and Senate. Every American would be able to afford quality, private health insurance. Americans would have a choice in where they get their care, and health insurance would be portable. So a job loss does not mean that you lose your insurance. It promotes prevention and wellness. Reforms are made to the insurance market so that insurers are forced to compete on price, benefits, and quality, and it was scored by the Congressional Budget Office to be budget neutral in 2014. Secondly, in the Medical Rights and Reform Bill, the doctor-patient relationship is protected so decisions aren't made by the government or insurance companies. State innovation is fostered through insurance market reforms, high-risk pools, community health networks, and pooling options for small business. Lawsuit reforms, which are essential in the Congressman's mind, would end the practice of defensive medicine and ensure fair compensation for injured patients. Health information technology programs would improve quality of care and reduce errors. It would eliminate waste, fraud, and abuse in Medicare, and prevention and wellness programs, which are critical to the Congressman, would address costly chronic diseases and promote healthy living. And finally, greater tax incentives would help individuals and small businesses actually buy health insurance. The Congressman supports a system where every American can get access to health care and prevent illnesses. Again, let me underline the concern the Congressman has about prevention and wellness programs. Bottom line is, individuals should not be denied coverage based on pre-existing conditions or put in financial peril because of medical costs. A one-size-fits-all solution will not succeed. We must retain the choice to keep our current coverage and support the safety nets on which the neediest Americans rely on S-CHIP, Medicaid, and community health centers, which the Congressman has been a consistent and avid supporter of. Finally, Americans must have confidence in what is put forth by Congress. And to do this, the process must be far more bipartisan than it has been. The Congressman is disappointed and concerned that the current legislation, but he remains hopeful that by working together And again, that can be done through forums such as this and with panels and experts such as this. That working together, we can enact meaningful solutions. Again, he apologizes. I know Senator Carper. The Congressman is not ducking this issue by any stretch. And we welcome your comments in any form that you can get them, whether it is simply calling our offices, whether you write us or email us. I mean, Delaware enjoys a magnificent access to its elected officials, and you demand that. And again, I spent 10 days at the state fair and heard many of you loud and clear, and it's appreciated. It is part of our democracy. We should be proud of it, and again, we should act appropriately, but we should enjoy the opportunities we have to have access to elected officials. So again, thank you all for all of your passions, wherever they may be, on this issue, and again, I appreciate it.
And with that, we're at the end. I want to make two final thank yous. I want to thank the City of Lewes and Mayor Ford and Ted Becker here for having the Lewes Police Department present, but I also want to thank your audience, this audience, that we didn't need it like the rest of the country. Thank you.